Thyroglossal cyst. A thyroglossal cyst is a fibrous cyst that forms from a persistent thyroglossal duct. A persistent thyroglossal duct is usually a benign medical condition in which the thyroglossal duct, which is a structure usually only found during embryonic development, fails to atrophy. The duct persists as a midline structure, forming an open connection between the back of the tongue and the thyroid gland. The thyroglossal duct runs from the base of the tongue at the foramen cecum to the thyroid gland. The embryonic thyroid gland or thyroid enlarge travels through the duct to reach its final normal position. Normally the thyroglossal duct then involutes in the 9th week of gestation, but when the duct persists, a thyroglossal duct cyst can develop anywhere along this tract. The location is either in the midline or paramedian. 65% are located infrahyoidal, 20% suprahyoidal, and 15% at the level of the hyoid. When there is a midline or a paramedian swelling, the differential diagnosis could be a thyroglossal duct cyst, necrotic anterior cervical node, or a thrombosed jugular vein. This is an example of a paramedian thyroglossal duct cyst. It is not in the midline, but the key finding is that this lesion is cystic and embedded in the strap musculature. The thyroglossal duct cyst presenting as a paramedian swelling. That is a thyroglossal duct cyst presenting as a midline swelling. The cyst manifested in the persistent thyroglossal duct which connects the foramen cecum to the thyroid gland. Presentation. Thyroglossal duct cyst presents as a midline neck lump in the region of the hyoid bone. It is usually painless, smooth and cystic. If infected, pain can occur. There may be difficulty in breathing, dysphagia, which is difficulty in swallowing, or dyspepsia, which is discomfort in the upper abdomen, especially if the lump becomes large. The most common location for a thyroglossal cyst is in the midline or slightly off midline, between the isthmus of the thyroid and the hyoid bone, or just above the hyoid bone. A thyroglossal cyst can develop anywhere along the thyroglossal duct, though cysts within the tongue or in the floor of the mouth are rare. A thyroglossal cyst will move upwards with protrusion of the tongue. I repeat, a thyroglossal cyst will move upward with protrusion of the tongue. Thyroglossal cysts are associated with an increased incidence of ectopic thyroid tissue. Occasionally, a lingual thyroid can be seen as a flattened strawberry-like lump at the base of the tongue. The thyroglossal tract arises from the foramen cecum at the junction of the anterior 2/3 and posterior 1/3 of the tongue. Any part of the tract can persist, causing a sinus, fistula or a cyst. Most fistulae are acquired following rupture or incision of the infected thyroglossal cyst. Thyroglossal cysts are lined by pseudostratified ciliated columnar epithelium, while the thyroglossal fistula is lined by columnar epithelium. Symptoms. A thyroglossal duct cyst most often presents with a palpable asymptomatic midline neck mass below the level of the hyoid bone. The mass on the neck moves during swallowing or on protrusion of the tongue because of its attachment to the tongue via the tract of thyroid descent. Some patients will have neck or throat pain or dysphagia. The persistent duct or sinus can promote oral secretions which may cause cysts to become infected. Up to half of thyroid glossal cysts are not diagnosed until adult life. and the tract can lie dormant for years or even decades until some kind of stimulus leads to cystic dilatation. Infection can sometimes cause the transient appearance of a mass or an enlargement of the cyst, at times with periodic recurrences. Spontaneous drainage may also occur. Treatment of a thyroglossal duct cyst is surgical resection, often requiring concomitant removal of the midsection of the hyoid bone, and this is called the cyst trunk procedure to prevent recurrence. Although generally benign, the cyst will be removed if the patient exhibits difficulty in breathing or swallowing, or if the cyst is infected. Even if these symptoms are not present, the cyst may be removed to eliminate the chance of infection or development of a carcinoma, or for cosmetic reasons if there is an unsightly protrusion from the neck. The cyst trunk procedure involves excision not only of the cyst but also of the parts tract and branches. A removal of the central portion of the hyoid bone is indicated to ensure complete removal of the tract. It is unlikely that there will be a recurrence after such an operation. Thyroid scans and thyroid function studies are ordered preoperatively, and this is important to demonstrate that normally functioning thyroid tissue is in its usual area. That's a thyroglossal duct cyst, a midline swelling that moves with protrusion of the tongue.